Hi, I'm Sean Ahrens. I live in San Francisco. I'm a programmer, a patient with Crohn's disease, which is an autoimmune disease of the digestive tract, which causes inflammation when you are flaring from the condition. And I build a network called Chronology. Chronology is a network of patients that are distributed throughout the globe. They use our software online at chronology.com or their mobile phone. And through these tools, they record their health over time. In effect, Chronology is a network, a real-time network of patients throughout the globe that as their symptoms are happening, whether it's abdominal pain, use of the restroom, nausea, they input this information into our mobile app or the website, and we get to create a great record of how they're doing compared to the treatments they're taking. And this is our network here on this map. There's over 3,000 patients currently using it, patients with Crohn's disease or ulcerative colitis. It's spreading rapidly, and I think this is an idea that shows the potential for mobile health. So the fundamental thing that we do, if you boil it down, is we ask patients like myself, how are you doing? And on the website, it's a simple slider like this, from yuck to fantastic, very basic. But what's really amazing about that is that you can also do that from your mobile device. So we have an SMS app, and we have a mobile iPhone app. And via SMS, you'll get a frequent, as frequent as you want, prompt to update Chronology on how you're doing. You say something like, a score from 1 to 100, as you would on the website, and we let you know, who in your sort of friend circle on Chronology is also sort of feeling the similar way to create some sort of camaraderie, and you can see that here. On our mobile app, the power is much stronger, so you're able to see graphs of how your health is doing over time, and you're also able to update detailed symptoms that aren't possible as easily over SMS. What we do is we just construct this data over time, and that basically creates this mapping of how each patient is doing. And if you think of the physicians right now who are seeing their patient at maybe 6-month intervals or year-long intervals, or maybe the patient never comes into the doctor's office, this data is really helpful for intervening when symptoms go awry. And then we ask patients what treatments are you doing, and how well are they working, and when did you do them? And so you'll see here that this is a timeline of treatments. These are actually treatments that I did myself to treat my own Crohn's. So I've done Remicade for a really long time, about 12 years. Pig whipworm, this experimental therapy using parasitic worms, and a number of other standard treatments. My experience in the healthcare system was one where I tried so many different treatments, and many of them failed. The particular problem with autoimmune conditions like Crohn's disease or colitis, or things like lupus, multiple sclerosis, psoriasis, conditions that 40 million Americans have, is that the drug options are actually very poor. And in the case of Remicade, for example, I actually can't so easily get off this drug because if I leave the drug, I'll build up a tolerance within a few months, and I can't go back on it. So you can understand how the decision-making is quite serious when it comes to changing your treatments for these conditions. So what we do is we map up how the user's overall health has been with that treatment timeline to gain insights about how things are working for patients. And then we anonymously aggregate and crunch that data to learn and share it back with researchers and patients themselves. And the fundamental reason you may be asking is why is this so important? And I think it's important to point to the fact that you'll probably sense this in your practice to come and as you go through medical school right now, that there's a growing and obvious disconnect between patients and physicians. And part of that is legal, part of it is practical, and part of it comes down to science. If you think of the legal ramifications, obviously, things like tort are the problem. If you look at the practicality, actually getting into the doctor's office takes a long time. But when it comes down to science, patients have their experience. We call those like anecdotes, right? And physicians must treat off of science, evidence-based knowledge. And up until now, these have been disconnected. An anecdote does not equal science. And I believe that mobile health actually changes this. Mobile health actually allows us to take the patient's experience, which they've currently been so frustrated with, like they're trying to tell their physician, this is what's happening for me. And they desire their physician to actually be this learning system that will take that patient's experience and learn for medicine and learn for other patients about what's working. And that's not happening right now, but mobile health can unlock that. And another helpful thing to put this in perspective is that out of the whole possibility realm of treatments that are out there, there's treatments that work and there's treatments that don't work. But the piece of the pie, the section that we're actually putting money behind studying, is only a subsection of that full possibility set of treatments that work. And usually that's due to economics. It can cost over $1 billion to get a drug through clinical trials. It's not unusual at all. And that means drugs have to make over $1 billion in return, far more than that. And so a lot of these treatments that are out here in this field don't get studied, and we don't have enough evidence behind them. And there's a good chance that the cure for these autoimmune conditions that affect 40 million Americans actually lies outside of what we're studying. And so the entire point of Chronology is for us to gather evidence in this field, also in this field as well. And essentially we have patients that are walking around with vast silos of data that's been untapped at this point. And that's what putting the Chronology mobile app in your pocket is seeking to do. It's seeking to bring data collection closer to the patient so we get more data and more accurate data. So all of this stuff comes together on our website. I showed some of this stuff on earlier slides, but this is the web view that you see of one's health record. And then we crunch that data anonymously, aggregate it, and we can help patients see that actually diets do play a role in Crohn's or colitis. And that's actually a very important finding. Diets do play a role in Crohn's or colitis are conclusions that we're finding on Chronology. Physicians will actually tell you, I've talked to probably about 10 different physicians, and they will all tell me that what I put in my body, what I put down my throat, actually can't change the course of the disease. And if you ask every patient, they all tell you it will. And so that's sort of evidence of that disconnect that we have. And so I want to bridge that connection better. So we also learn, what's the next medication people tend to do after failing these drugs. We have a whole bunch of stats that help patients guide their path when they're kind of considering treatment options. And then furthermore, on top of that, we use this backbone of health information on each patient to be able to smartly route questions to patients that can answer it. So if I have a question about a drug, say Humira, for example, it goes to patients that have taken that drug. And then we allow these patients to meet up in person to get that emotional connection that they may be lacking in the physician's office. So I showed you a lot about Chronology, and I alluded to the fact that I'm a patient myself, but it's important to kind of know the backstory of this a little bit to put it in perspective. So I was a 12-year-old kid, and then suddenly I came down with something like a stomach flu, and as I grew older throughout my teens, I went through flares of the condition. This is me on the far right here, super skinny, losing tons of weight. This is actually me doing a little bit of the opposite on a drug called prednisone, which flared up my face and body. And so I went from having this continuous data over time that only I could see all of it, all these symptoms that were happening day to day. And visiting my doctor and seeing that, my doctor would see me at certain points and he would miss the full picture. And I met other patients. And once I started meeting other patients while I was in college, I realized that everyone had these stories of like, hey, no one's listening to this whole story that I could be telling, all this data that I could be telling. And so we started exchanging data over dinner tables. And I realized, maybe there should be something that should solve this at scale for patients that live in smaller cities, that live throughout the globe, and that collectively we could actually possibly find the cause or cure of conditions like Crohn's disease and ulcerative colitis through that network. And it really hit ahead when I had to start tracking my own health, because I, like many patients out there, tried something that was outside the doctor's office. And if I hadn't been so keen on recording my symptoms, this data would have been lost. And this data I'm alluding to is when I did that pig whipworm therapy that I showed earlier. It's in scientific terms, it's called Trichuris sus ova, pig whipworm eggs. And it's a new experimental therapy that some studies are being done on right now. And I paid $3,000 to have this parasitic worms mail-ordered from Thailand. It came to me, and I realized if I'm going to do such a crazy treatment, I better leave a paper trail, and I better help other patients through it. So I built what was then the beginning of Chronology, this mobile interface that allowed me to track my health, and I tracked it, and now I'm sharing it with patients. What I learned from that experience was that the tools to accurately and scientifically record your health require quite a bit of development. And to actually be able to make conclusions about what treatments work, you want to have a larger N of patients doing the same thing. And so that's why I built Chronology, so I can take my data and learn from everyone else's as well. So that continuous stream of my health gets uploaded. So the story of Chronology was from those origins, and now me and my buddy Will Cole got together. We went through the Y Combinator and Rock Health startup incubator programs out here in San Francisco. Y Combinator probably the most well-known out of that, led by Paul Graham, and Rock Health by Hallie Tecco, who each of these gave us initial leg up to seek funding and office space to build our product. So what we're currently in the process of right now is pairing our data with academics, with researchers, so that we can pair this with genetic data, with microbiome data, the bacterial composition in your gut, for example, so that we can actually learn how to practice personalized medicine. Right now, as you know, medicine is practiced at a population level. But if we have the phenotype, the symptom expression of each patient out there with these mysterious conditions, paired with things like their genotype or their microbiome, we're going to start to understand why treatments don't work in some patients and do work in others. It's not random. It's not voodoo. It's not a mystery. There's actual science behind why certain patients don't respond to treatments. And this data is going to help unlock that, and that's going to usher in the new era of personalized medicine. So if you are a researcher, I encourage you to reach out. So that is us. This is my team, myself, Sean Ahrens, Will Cole, and Sarah Brannon, and we are building Chronology and hope to bring this to many more conditions soon. So thank you so much for tuning in, and I hope you learned a thing or two about how we're practicing mobile medicine and the future of healthcare. Thank you. So this is the Chronology mobile app. Its main feature consists of this chronological timeline of a user's health input. So we allow patients to record food, we allow them to record use of the restroom, gut pain, any common symptoms of the digestive conditions, Crohn's or colitis, and those go into the stream here. You input those health inputs through the bottom nav. So you would click on overall health to update how you're doing overall. And you save that data point. And that goes into the stream. You can upload a note, something you did or how you're feeling. You can upload food, clicking there, take a picture of your food, save, gets added to the stream. And the same goes with use of the restroom or other symptoms. Your overall health actually is along the left side here. And so as you scroll through your health journal, you'll see this graph of how you've been doing during those times move along with it. You can then see graphs of all those data points to compare it with your overall health. So like the riskiness of your food, your use of the restroom or looseness of your bowels, treatments that you've been taking, how have those been affecting your core symptoms? And again, this data all goes together. We aggregate and anonymously learn what treatments are actually working for the population. So that's the Chronology app.